Hello everyone. So, let's discuss about fibroadenoma. Fibroadenoma is a disease of breast mainly found in females of reproductive age group. And why this disease is mainly found in females of reproductive age group, that we will discuss later. And as it is a disease of reproductive age group, so it is a cause of major cosmetic concern. And the two type of cells forms two type of tissues, the fibrous tissues and the glandular tissues. The fibrous tissues are formed by the stromal cells, which is responsible for the structural part of the breast, and the glandular tissues are formed by the parenchymal cells, which are responsible for the functional part of the breast, which produces milk. And fibroadenoma is a benign growth or a lump in the breast seen only in women. And why it is called benign? Because it is non-dangerous, means it will not develop into malignancy. The lump is rubbery, well defined, and may vary from one to many, and it feels like a rounded marble within the breast and have clear-cut borders. Physiology. But before talking about pathophysiology, we must be knowing about anatomy of a normal human breast. A normal human breast consists of lobules, ducts, and sinuses. Lobules are the functional part of the breast which produces milk, and ducts are the structures which carry the milk from lobules to the sinus, and sinus are the structures which store the milk. What happens in fibroadenoma? At the age of menarche, lobular structures are added to the ducts of breast. Means the ducts of breast are formed earlier, but the lobes are developed at the age of menarche. And at that age, there is hyperplasia of the lobule because the stromal and epithelial cells which are present in the lobes contain hormonal receptors for estrogen and progesterone, which helps or which contribute in the abnormal growth of the stromal and epithelial cells. And for this reason, fibroadenoma develop during menarche, pregnancy, female who take OCP, and young females between 15 to 35 years of age. What are the types of fibroadenoma? Fibroadenomas are commonly of two types, simple and complex. Simple fibroadenomas are mainly seen in young females and there is only one lumpy growth is seen, while in complex fibroadenoma, they are mainly seen in females above the age of 40 years and multiple fibrous growth are seen. What risk factors are responsible for fibroadenoma? Age of menarche due to secretion of estrogen, oral contraceptive pills because they also contain estrogen and progesterone hormone, and females consuming alcohol beverages and cigarette smoking. How fibroadenoma can be diagnosed? The diagnosis of fibroadenoma should be done in following steps. The doctor should physically examine the patient, and after physical examination, if a smooth and mobile lump is felt, then the doctor should go for mammogram. Mammogram can show abnormal areas or tissue in the breast. Then mammogram is followed by ultrasonography. Ultrasonography can give more accurate results and it can give more information about small areas of interest within the breast that may be difficult to see in mammogram. And then ultrasonography is followed by biopsy. Biopsy is done to make sure whether the lump is fibroadenoma or some other condition, such as breast cancer or fibroadenosis. How can we manage fibroadenoma? Fibroadenoma is a complete surgical disease, but in most of the conditions, surgery is not required. But surgery is recommended only when there is pain and the lump is bigger in size or multiple in number, causing cosmetic problem. And the surgeries which can be performed in fibroadenomas are lumpectomy, also known as excisional biopsy or cryoablation. In lumpectomy, we remove the lump and send it to laboratory for further evaluation. And it is also done as a diagnostic procedure. What are the differential diagnoses of fibroadenoma? There are mainly three diseases which resemble fibroadenoma and can be mistaken as fibroadenoma, and they are breast cancer, fibrocystic breast disease, also known as fibroadenosis or phylloid tumor. Fibroadenoma have a very good prognosis because it is benign, means it is not dangerous, it will not convert into cancer, and the complex type of fibroadenoma is also rare. The complications of fibroadenoma are very rare, so no need to worry. But the complications can be breast cancer or complex fibroadenoma. Thank you.